नाही ठीक आहे हरकत नाही. कारण ऑलरेडी we have got couple of colleges are in contact with. I think मागच्या वेळेस आपण काय डिस्कस केलं होतं? What did we discuss in the last class? पहिल्या लेक्चरला काय लिहिलं? आपण ते रिपीट करूया काय करूया? Okay. Okay. Let's start with basic. हरकत नाही ठीक आहे. आज एक इंट्रोडक्टरी लेक्चर आपण चालू करूया. बट बिफोर दॅट काही इम्पॉर्टंट अनाउन्समेंट जे आहेत ते आपण डिस्कस करू. Now this CCMP course आपले 3 पोर्टल असणार आहेत फॉर CCMP पोर्ट. फर्स्ट इज अ दादर ब्रांच. That is what we are there right now. Second one is a Nerul branch, which is already started and 2 lectures have been done. And here we have every Thursday 3:30 to 5:30 p.m. It is already started. There are about 20 students, 17 to 18 students which already are registered. And third portal, which is what is we have finalized in the last week. Now, for both of these classroom lectures, it will be about 6 to 7 months course. ते आपण already discuss केलं. 8 months पण जाऊ शकतो. It will be once in a week lecture, and this covers about all topics, all subjects rather. Paper 1 as well as in paper 2. This also covers the revision during exams. This also covers revision during the exams. Now, what is the third portal? Because a lot of students are asking for it these days. Now, this third portal will be the online portal. Now, let me explain, because it is we already are taking live online lectures. पण live online lectures ला बरेच जण comfortable तुमच्या एज ला नाहीये, because students are opting for it. So live online lectures are those lectures which are conducted just like this class, where the whiteboard is also there, but I'll be teaching from my place, you'll be listening to your place. It'll be live lectures, so you can ask doubts, you can raise your hands, and everything becomes an interactive one. That is, live online is one option, but last year also I wanted to initiate this for CCMP students, but there was little incompatibility between the online codes and password and network and all those things. लोक म्हटले की if we miss the lecture, can we see it again? In live online lectures, you cannot see it again. You neither can record it. You cannot even record it, because even if the recording quality will be so poor that you won't be able to listen it again. So because it may not be possible, because you're all practicing doctors, to come at the same place at the same time and give that amount of time. For students, we are taking it for about 4 to 5 years. We are taking this for students because we fix the time. At that particular time, somebody is in Santa Cruz, somebody is in Nasik, somebody is in Pune. All can come together. Online platform where the same whiteboard is there. You'll be able to see my face only this much through a camera. You may shut off your camera. You may keep your camera on so that we will be able to see you. Otherwise, lecture goes as smoothly as the classroom lecture. Because today's age, everyone has got a 4G and VoLTE and all those things, and we don't know how to utilize that 1 GB per day. This consumes about 100 MB per hour of lecture. So it's very comfortable. Even if you take everyday lecture, you can use only 100 MB, 100 MB, maximum 120 MB if you share videos and all. What is the problem in this is you cannot see it again. The other problem is you will have to be available at the same place, and your network should be okay, your battery should be charged. Even if you're traveling, you'll be able to attend those live lectures, even if you're traveling. But the trouble is, we cannot see it again. The other trouble is, the advantage is you can ask doubts. That is what is online live. But currently, I'm not thinking about this for CCMP because बऱ्याच तो disturbance होतो. We practicing doctors are. What is the option which we made available last week? It's already been almost started kind of. Now, हे जे classroom programs आहेत, त्यांची fees will be 16,000. or both the papers for complete subject along with the revisions during the exams. 7 ते 8 महिन्यामध्ये टॉपिक फिनिश झाले तरी during prelims and finals we'll give you the revisions. In the other portal which I wanted to, because last year some of the lectures have recorded. This year one branch is already started at Nehru. There also I am recording lectures. What is the other option is I'll be sharing those recorded videos to you. Just like you must have seen some of my YouTube videos. Those recorded videos will be shared on a private group, or I can say a secret group on Facebook. Everyone need to be there on Facebook, or we will be helping you to open the account in Facebook if you don't have. The secret group advantage is nobody can enter into that group unless my permission is there. Second important thing is those secret group the videos will be shared. I will be uploading my private videos of the YouTube. You won't be able to see that video unless my permission is there. That video I'm going to upload throughout the year. Whenever I'll conduct lecture at year, Nehru, or maybe the last time ka lecture, whichever is good, recorded good, because recording quality needs to be good. Otherwise, if voice is not that good, then I'm not going to share that video. I'm going to share the option which is available to me. That video will be available for 24 hours on one particular day. In the 24 hours, you'll be able to see it once, twice, three, four, how much ever time you want to see. But after 24 hours, the link will expire. You won't be able to see that video after 24 hours. When I discussed this with my other student, they also said, sir, keep it open throughout the year. The disadvantage of keeping the video throughout the year is when we have option to see the video anytime, that anytime doesn't come up anytime. That हम लोग कभी भी देख सकते हैं क्योंकि हम लोग कभी नहीं देखते, लेकिन फिर बाद में only 1 month is remaining. If you know कि आज ही करना पड़ेगा जो भी है, then you will be opening that link and you will be once or twice or thrice you will be able to see it. Don't worry about that. But the link will go off in 24 hours. 24 hours में आप 2 बार 3 बार भी देख सकते हो, pause करके देख सकते हो, rewind करके देख सकते हो, and all those things. In this, the only trouble is I won't be live at that particular time. So if you have any doubt, you can just give me a WhatsApp at the end of the during the lecture or at the end of the lecture. You may pause it and you can send me a WhatsApp, wait for my response, or you can see it through the video, send me a doubt, and then I can solve it out. Because most of the time, मैंने जो lectures ले रहा हूँ, very simple language. I don't think it will be very complicated to answer all those things. In this option, in this all the videos, all the lectures will be sent. In this, some additional videos will also be sent to make you clear about, because I already have my anatomy and physiological videos. So basically, if you have been good in anatomy and physiology, it becomes easy to understand pharmacology and the others. So because I don't have to put extra time, so I can share apart from the CCMP lectures, the other lectures will also be shared, which will be happy. For example, cardiovascular system है तो cardiac physiology का lecture पहले भेजता हूँ. We go to that cardiac physiology lecture because मेरे को सिर्फ एक link आपको share करना है. I don't have to put in extra time, which is not possible in these classroom lectures. I cannot take anatomy, physiology, and then pharmacology because we will have to be open to this new technology these days. अभी इसमें क्या होगा? For example, your exam is next year. Next year is your exam. So what about during the revisions and all? In this particular portal, even the revision lectures will also be sent. In fact, we can also send some of the important lectures, like for example, cardiac pharmacology, like for example, case taking, like for example, some difficult topics again during the exams, but not all. Some of them, along with the proper revision lectures, in which all the topics will be covered again in a quick manner. So these will be, I can say, convenient for somebody who cannot travel on every Sunday, convenient for somebody who stays far, convenient for somebody who has got an उसको एक बार बोलने से शायद नहीं समझता है तो बार बार सुन के उसको समझ में आता है फॉर एग्जांपल. तो दैट फॉर दैट दे विल बी कंफर्टेबल. इसमें टॉपिक सारे कवर हो जाएगा लेकिन लाइव कोई ऑनलाइन जब ऑन दैट एट दैट पर्टिकुलर पॉइंट लाइव कोई नहीं रहेगा. दिस विल बी कवर्ड स्पेशली फॉर द CCMP स्टूडेंट्स. मेरे 2-3 साल के जो लेक्चर्स हैं कुछ कुछ लेक्चर्स अच्छे रिकॉर्ड हुए हैं, कुछ कुछ लेक्चर जो अभी लेने वाला हूँ नेहरू में वो रिकॉर्ड हो गए, या तो फिर यहाँ पे अगर यहाँ पे भी अपना बैच अच्छा बनता है that time we can also record because your recording quality is much better because the camera is just in front of you. There the camera is not just very much in front of you. तो ये ऑप्शन रहेगा आपको लगभग इसका हाफ ऑफ द प्राइस में 8,000. In this notes will also be given to you. Notes उसमें 8,000 में आपको सारे लेक्चर्स आ जाएंगे. And this will be a secret group on the Facebook on which the private videos of the YouTube will be seen. अभी मेरे जो वीडियोस है वो ओपन वीडियोस हैं. That has only introductory lectures या तो फिर कुछ कुछ लेक्चर्स की जो सबको लगता है. For example, my autonomic nervous system lectures been seen by 3,000 students till now. तो वो मैंने I think 7 to 8 months back only, but that was what everyone has got a problem. और उसमें कैसा बार बार बम्बार्डिंग हो तो ऑटोनॉमिक नर्वस सिस्टम समझ में आता है. So this is what will be third option available. इसमें अगर ग्रुप बड़ा है तो we can give you discounts also. क्योंकि मेरे को सिर्फ क्या करने की एक but in this the YouTube का setting says more than 30 students I cannot take. That is what is on YouTube का setting in which I cannot share more than 30 students at one time, one particular time. So इसके लिए तो already open मैंने रखा हुआ है. This will be again one time payment, no installments kind of. So 8,000 में आपको notes मिल जाएगा. Along with that, all the lectures. We also were planning to keep once in a month lecture in this. महीने में एक बार. इसमें जो भी 4 lectures हुए उसका revision हो जाएगा. वो एक महीने में. तो in a classroom lecture. Those who can come down. That is all. Because इसमें बहुत सारे स्टूडेंट जो खेड के हैं, बहुत सारे स्टूडेंट जो अमरावती के हैं, they were also asking for it because they cannot travel. पुणे के students also they will not come up because our videos are being shared everywhere now. Last time जो मैंने आपण जे revision घेतलं होतं मॅडम क्लास paper 2 is being seen by 900 students till now. किती 2 last week ना last week right. So that is what is an advantage of maybe we'll be able to revise it again and again. Now this will be covered in half of the cost. And in that also you will be able to see on that particular day only. Especially I'll be putting it only on Sunday. क्योंकि संडे को कैसा है कि एवरीवन कैन एटलीस्ट टेक आउट 2 घंटे का टाइम एंड वी कैन लिसन टू इट. मे बी सुबह एक बार देख लिया, दोपहर को थोड़ा देख लिया, मेहमान आ गए, रात को भी एक बार देख लिया फॉर एग्जांपल. बट इन 24 hours this is going to go. But the link is going to get expired. That is what is the setting it's been done already. So you talk to your friends. Maybe if they're comfortable here or here, we can adjust them anywhere. That is what is the plan. We are promoting more of these because for non-Mumbai students especially or those who cannot travel down. कि उनके लिए हम लोग ये ज़्यादा प्लान कर रहे हैं because lot of students and also it will be covered in maybe only one subject का cost. People are maybe asking for maybe 10,000 rupees for one subject. They're taking all the 5 subjects and all. That is what is being proposed right now. आपण हे propose करें. You discuss with your friends. मी मुद्दा में थोड़ा सा घेतलं so that we can understand कि what are we going to take and how are we going to take. Right? Let's start the topic right now. Let's start this is what we are planning to. जनरल फार्मेक चालू करूया कि जो वांटेड मेडिसिन और समथिंग में फार्मेक ओके ठीक है. Let's start with the most basic one. We're not going to take a complicated topic today. Now let's say for example, and I remember general फार्मेक काही लिहू नका. Don't write down anything. In pharmacology, general pharmac has almost, I can say for Ccmp students, 25 to 30% weight. Not in terms of questions. The questions are also more, but 25 to 30% weight because the understanding is very important in general pharmac. If you are able to understand general pharmacology well, you are able to understand the whole pharmac. Because general pharmac has concepts which help us understand how do you decide the route of the drug. How do you decide the dose of the drug? How do you decide the frequency of the drug? How do you decide the combinations of the drug? What are the common side effects of the drug? How do you decide the variation in the dose depending upon age, depending upon the sex, depending upon the other states? It also includes the concepts which gives an idea about how exactly drug is excreted, how exactly drug is absorbed by the body. So that all these concepts Most important, how exactly drug act on the body. All these concepts, if you see properly, are so much important in pharmacology that this becomes a stem, or this becomes, for example, if the pharmac is a building, this becomes an RCC construction, columns. Because if these columns are weak, how much ever better, how much ever good you build the walls is going to collapse. How exactly, what are the receptors and what is an agonist and antagonist and all. So he is agreed. All these things will be covered in the general format. So these concepts are extremely important. Let's say all of us know, let's start few questions, let's answer it today. Let's say the most common way the drug is given by which route? All of us know an oral route, right? And in the oral also we have certain formulations which are important. Like for example, in the oral itself we have a tablet form, a capsule form, a powder form, suspension form, syrup form, all those forms, and the most widely any drug is available in the formulation is the oral forms, in the oral forms. So let's first understand what will happen when the drug is consumed orally and how exactly drug is going to, how will you decide the dose, frequency, combinations, and some of these questions like a story we can understand. Let's say we have consumed some drug orally. Let's say we have consumed a tablet form. Most common way is a tablet. Now we understand it like a story. What will happen when the tablet is consumed? How exactly does it moves in the body? And या सगळ्या प्रकारचे answers कसं आपल्याला find out करता येते. Let's say we have consumed a tablet. Anything happens in the stomach? What does stomach do? Stomach does something. Stomach will secrete an acid. The acid is going to act on the tablet. What is it going to do? It may be because acid may also damage the tablet. So most of the tablet are coated with a covering which will not get dissolved in the acid. So that the drug is inside. Because I don't know. See, you want the food to be acted upon by acid. Do you want the drug to be acted upon by acid? Because if the drug acts on the acid acts on the drug will be destroyed. So all this coating is called as what? Enteric coating. You may break some tablets. If you see there is a thick covering on it, that is also an enteric coating, so that the drug doesn't get attacked by an acid. This drug, if it is not affected by the acid, it may dissolve in the stomach. It may dissolve in the stomach. Now, what does stomach do? Stomach either will keep the tablet as it is, or it may also dissolve the tablet. Depending upon, let's say for example, if you consume a capsule, what will happen? Capsule, as soon as you keep in the water, it will open up. The capsule is going to get broken and capsule will be released. The powder, the drug will be released in the stomach. So stomach, it may keep the drug as it is, or it may also dissolve the drug. Now, does it also help in absorption? Stomach also absorbs the drug. Stomach absorbs the drug, is made for absorption. First of all, stomach has got very thick wall, and it is difficult to absorb the drug by a thick wall. Along with that, all of you already must know that there is a coating on the stomach wall because acid should not affect the wall of the stomach. So there is a coating of what? Mucus, mucus lining. So that this green color is a mucus lining coating which will protect the stomach wall from the acid. So because of this coating, it is difficult for the drug also to go through the coating and be available for an absorption. Except only few drugs or chemicals are absorbed. Like for example, we have an aspirin, right? An alcohol, and all the drugs which are acidic in nature. Drugs which are acidic in, all the stimulants are also absorbed. Like for example, which are the drugs which are acidic in nature? Even tobacco is also a drug. Tobacco is acidic in nature, it is get absorbed. All the stimulant, caffeine is what? Is also a stimulant, is acidic in nature. So caffeine, tobacco, or I can say nicotine, rather I can say all stimulants are absorbed is what we can say. But most of the drugs are not absorbed by the stomach. It remains as it is, or it may dissolve. It is waiting for the drug to go into the small intestine. So this first step after the drug is consumed is called a dissolution. Is called as dissolution. Then what happens when the drug comes into the small intestine? It's a small intestine phase. And all of us know that small intestine is the place for is a place for absorption. Everything what you eat gets absorbed from small intestine. This duodenum, jejunum, and ileum. Duodenum, jejunum, and ileum. So small intestine absorbs the drug. The small intestine has got a villi which will absorb the drug. Where exactly drug will go? Because if for the drug to be absorbed, either it needs to be broken down into a powder form or I can say molecular form. So as soon as this tablet which is not dissolved in the stomach comes to the small intestine, the coating is made in such a way that coating is will be dissolved only in the alkaline juice. Now what is the juice? What are the secretions of the small intestine? Acidic or alkaline? Alkaline, because here we have a bile comes up. Including the intestinal juices are also alkaline in nature. So as soon as a tablet comes here, let's say the black one was a tablet and the red one was a coating on it. So this coating will get dissolved and the tablet is now available for absorption, or the powder form of the drug will be released. So absorbs this drug. And where exactly does it go? Absorption goes into, now remember, everything absorbed from the small intestine goes to liver. Portal circulation goes to liver. Portal circulation goes to liver. Because here we have, let's say for example, if it is a food, let's say if we have had a gulab jam, so gulab jam will be converted into a semi-solid form by the stomach. Gulab jam will be broken down into simple fragments by the intestinal juice and it goes to the liver first because all metabolism happens in the liver. So will absorb the drug. So drug will also move similarly. Drug will also goes to liver. Now here the important question is asked that what are the factors that determine the rate of absorption? Now it is logical. Factors that determine rate of absorption. काय असेल तुमच्यामध्ये? Because this is what is very commonly short note can be asked or maybe viva they may ask for CCMP students. What are the factors that determine the rate of absorption? कुठले factors असतील हे? First of all, physical property. That means I can say molecular weight of the drug or molecular weight becomes a microscopic property. Let's say a physical form. If the drug is there in the microfine powder form, the other drug is in the tablet form, which will be absorbed faster. Molecular form or powder form will be absorbed faster because it is easy for the permeability. The first thing is the physical form. So, in comparison with tablet, capsule, powder, syrup, and suspension, which one will be having highest absorption? Capsules will be having also because capsule may what do we have in the capsule is again microfine powder form. Suspension and syrup are also already in the liquid form, so will be absorbed faster. Tablet may take time. Tablet may take time. So physical property, physical form. What is the other thing in which absorption depends upon? Of of
For the absorption area.
it is a surface area, right? Available for absorption. More is the surface area. More will the absorption. This will be directly proportional. Surface area available for an absorption. And in the small intestine, if it is the lumen of the small intestine is like this, these are the cells, I can say columnar cells. But the surface area is increased much more because of presence of, what is that? Villi. They say the surface area of the small intestine is as good as a football stadium. As big as the football stadium. So, more the surface area, more may be the only on surface area it depends upon or something else also.
the size of the tablet?
Size, after any, whatever was the size of the tablet, small intestine goes, it becomes a powder form. It also depends upon the blood supply of the intestine. Blood supply of the intestine. More is the blood supply, more will be directly proportional. Again, directly proportional. Only blood supply and surface area is not enough. Food should be able to move in the small intestine. So the motility, intestinal motility. The food is moving, that will help the villi to expose all their surfaces to the food, and that will help the absorption. Now, you want the food motility should be there or should be not there? Should be there. If there is no motility, what happens? Food remains here itself. I can say drug remains here in the powder form, of course. Will it be absorbed faster? If it is exposed to different parts of the, then the more area will be exposed, right? So motility should be there. If it is too much motility, then
Treated faster.
that is what. So we require an adequate motility. Even constipation doesn't absorb the food or the drug properly, or even diarrhea, if the patient has, also doesn't absorb the drug. See, this is all common sense. But hey, Sagra, you should be able to point out 1, 2, 3, 4, 5. Then it becomes easy. Arjun, pH of the drug or pH of what? See, pH, molecular weight will help the distribution of the drug rather than absorption. Absorption is one thing, distribution is the other thing. What is the other thing which depends upon? The presence of food. If the drug is given along with the food, what will happen to absorption? Less or more? I'm talking about only drug. If the drug is given along with the food, what will happen to the ability of the drug to get absorbed? I'm talking about effect, for example. Or let's say, for example, this drug is given along with the full meal. So full meal will also move. Full meal will also be absorbed. So drugs absorption will be a little bit delayed. So because of that, usually when you are giving any drug which is producing, let's say for example, antibiotic, we always say antibiotics supposed to be taken before food. Of course, there are a lot of drugs which are given along with the food, because if it gets absorbed too fast, then it can create a problem. So by and large, food will delay the drug absorption. You must have also got an experience that when you take a painkiller, if you take painkiller after food, painkiller effect comes little late than if you take an empty stomach, because the absorption is much better. So all are these factors which determine the rate of absorption. This is, I'm talking about an oral route. I'm not talking about any other route right now. These are the factors which determine the rate of absorption. So we are at the second step right now. Second step says small intestine is going to absorb through villi. It goes to the liver, and these are the factors which determine the rate of absorption. So when it goes to the liver, what does liver do? Remember, any food item, when it goes to the liver, what does it do? Let's say, for example, uh, carbohydrate goes to the liver. What happens to carbohydrates? It metabolizes, but ultimately becomes what? Glucose. All carbohydrates broken down to glucose. If the fat goes to the liver, what does it do? Again, it becomes fatty acid. If the protein goes to the liver, what does it do? It becomes an amino acids. Now remember what is happening. Liver has got an ability to break all complex molecules to simple molecules, because we are able to utilize carbohydrate only in the form of glucose, fat only in the form of fatty acids, protein only in the form of amino acids. If the body wants to build up in muscles, do we eat mussels? We may eat mussels if you are a non-vegetarian, but that too also is broken down to amino acid, and then your muscle is going to get formed. So every of these complicated molecules broken down to simple molecules. broken down to simple molecules. That is what is that? Because liver has got an ability to have all those enzymes to break complicated molecules to simple molecules. So what is liver going to do with the drug then? What is liver going to do with the drug? Liver is also going to do the same thing to the drug. Liver is also going to break the complicated molecules of the drug to a simple molecule. Let's say, for example, this is what is a drug. Liver, as soon as the drug goes to the liver, this liver molecule is broken down to this separate, and this separate. That means this complicated formula is going to change to this simple molecules. Liver will not differentiate, नहीं ये तो drug है, ये तो अलग काम के लिए लिया है, ये food थोड़ी ना है. लेकिन liver is going to act similarly to the drug. Now, when liver acts on the drug and breaks down to simple molecules, will drug remain a drug? The drug will no longer remain a drug because drug is a drug because of this formula, the chemical nature. So, in this third step, which is metabolizing the drug, before even it is absorbed into all our body, अजून absorb झाले का all over body? नाही झाले. So this is what is called as a first pass metabolism. काय म्हणतात त्याला? This is called as first pass metabolism. First pass metabolism. So how will you define it now? Remember, definitions which will be important to remember only during the exams. Currently, only understand the concept. आतापासून definitions you don't have to remember. Even if you are able to remember, you are going to forget it during up to the exams. So आतापर्यंत you just understand the concept. So what is first pass metabolism? Is this. As much as most of the drugs, let's say up to 80% of the drug is destroyed. I can say destroyed here. I can say metabolism for the food. But here drug is no longer remaining a drug. So we can also use a word called as destroyed. Or I can say metabolized. So how will you define this definition?
With an extent of absorption of the drug
Huh?
from the layer, for the type of from the area of absorption to the into the systemic circulation. Amount of
पण अजून सिस्टमिक सर्क्युलेशन गेलेलंच नाहीये.
amount of drug that is reached to the liver in unchanged form. No, it is changed only. Just changed.
Unchanged form is bioavailability. आपण त्याच्याकडे अजून पोहोचलेलो नाहीये. राईट. म्हणजे मी अजून माटून गेलाय, तुम्ही दादरला पोहोचलात. रिमेंबर, हे फर्स्ट पास मेटाबॉलिझम नंतर अनचेंज फॉर्म कुठे जातो? सिस्टमिक सर्क्युलेशन मध्ये. दॅट इज व्हॉट इज बायोअवेलेबिलिटी. वी आर ओनली टिल लिव्हर राईट नाउ. सो फर्स्ट पास metabolism can be defined as amount of drug that is metabolized by the liver even before it reaches to systemic circulation. Has it reached to systemic circulation till now? It is not. And usually, by and large, we define this only for the oral route of drug administration. So we can also include that the amount of drug which is destroyed by the liver before even it reaches to systemic circulation in case of an oral route of drug administration. Because intramuscular में आएगा ये first part it won't come. So this is an amount of drug that is metabolized by the liver before it reaches to systemic circulation in an oral route of drug administration. Now, it is not compulsory that all drugs should be destroyed 80%. Some drugs are destroyed only 50%. Some drugs are destroyed only 10%. Some drug has got no first pass metabolism. Some drug has got 99% first pass metabolism. It depends upon the drug. It depends upon the drug. Let's say, for example, if you take an enzyme, insulin, what is the first pass metabolism for insulin? Insulin, do we take oral insulin? Because the first pass metabolism is 100% for insulin. So we cannot take it orally. Why we cannot take it orally? Because insulin has got 100% first, doesn't reach to systemic circulation at all. Because insulin is a natural hormone. All the natural hormones are proteins in nature. Proteins are काय होतं? All proteins are converted into amino acid. Do we have serum protein level? We have serum albumin level, serum globulin level, which are the broken down products of the protein. We have serum amino acid level, but we don't have it. We have serum gulab jam levels, serum jalebi levels. Every gulab jam jalebi is broken down to. So because of that, those drugs which has got 100% first pass metabolism cannot be taken. Any antibiotic which has got 100% first pass metabolism, aminoglycosides, streptomycin, gentamicin, हम लोग orally देते हैं, नहीं देते, only intramuscular or intravenous. The reason behind that, it has got 100% first pass metabolism. So we have reached up to here: dissolution, absorption, and first pass metabolism. Now, after the first pass metabolism, whatever drug that remains, कहाँ पे जाएगा वो drug? Whatever drug that remains. Let me have a fourth point here. Whatever drug that remains, कितना drug रह गया था? 20%. Now, where will that drug go? To systemic circulation. Liver से absorb होके वो जाएगा. Hepatic vein, inferior vena क्या हुआ? Goes to heart, testicle. So fourth one is, I can say, the amount of drug that जो 20% बचा था, that reaches to systemic circulation. कहाँ पे जाता है वो? Now this is called as what? Bioavailability. This is called as bioavailability. Bioavailability मतलब इतना ड्रग अवेलेबल हुआ किसको? Bio मतलब बॉडी को. So how will you define this again? See, definition need to be understood and then by hearted. By heart अभी मत करो, एग्जाम के एक महीना पहले. So how will you define this? That reaches to in unchanged form. आता तो तुमचा आला unchanged form वाला. कारण why unchanged form म्हटले मी? Is the amount of drug, or you can say percentage of the drug, or amount of the drug that reaches to systemic circulation in unchanged form. Why unchanged form is important? Because it may get destroyed and the destruction product also reaches to systemic circulation. But that is a changed form. That is not an unchanged form. So it's an unchanged form. Amount of drug, percentage of drug that reaches to systemic circulation in the unchanged form can also include after the first pass metabolism. After the first pass metabolism. This is called bioavailability. Bioavailability. Now, yeah, bioavailability, one more parallel concept is there. There is what is called bioequivalent. One more concept is called as bioequivalent, which may be given in some of the books, which may not, but this is very commonly asked in the Vivas. Bioequivalent. Let's say, for example, some drug has got 80% first pass metabolism. Manje, if you want 20 milligram to reach to systemic circulation, how much you are supposed to give? 100 milligram. You want 20 milligram to reach to blood, 80% तो डिस्ट्रॉय होने वाला है कहाँ पे? लिवर में. So if you want to give oral, how much you are supposed to give? बराबर? This is in the form of a tablet. तो तुमको कितना देना होगा? 100 milligram, because 80% drug will be destroyed by the liver. Same drug अगर मुझे इंट्रामस्कुलर देना है, इंट्रामस्कुलर में फर्स्ट पास मेटाबॉलिज्म होता है, it directly goes to systemic circulation. So ये तो होगा नहीं. Intramuscular में some drug may remain bound to the muscles and all the other drug goes to systemic circulation. So if I am going to give intramuscular form, I will have to give 25 to 30 milligram that goes to systemic circulation in the 20 milligram form. क्योंकि इसका बायो अवेलेबिलिटी कितना है इंट्रामस्कुलर का? 90%. You may think that it is 100%, but some drug bounds to the local proteins in the muscles. gets bound to the local protein in the muscle. If you want to be intravenous form, because all drug goes to systemic circulation directly. So what are all these? They are the different formulations producing the same amount of drug going to systemic circulation. Barabar? So these all called as a bioequivalent. They are equivalent in their potency. Oral may be 100, intramuscular may be 25, or intravenous may be 20 milligram. Because all of them are making the drug to go into systemic circulation equally. Called as by, hey, this is only for your understanding. You're not supposed to write in the exams, but sometimes in Viva they may ask about bioequivalent. Bioequivalent. So that is what is called bioavailability. And after the drug is available to systemic circulation, it will be distributed in the body. It will be distributed in the body. What is it called as? This is what is called as distribution of the drug. Or every drug dissolves in a volume called as a volume of distribution. This is what is called as volume of distribution. What is that volume? When every drug is dissolved in the body in a particular volume, in a particular volume, called as a volume of distribution. Volume of distribution. Now, this volume may not be similar to all. The reason behind that, every drug is different. That means, let's say for example, this is what is the body. Some drug gets dissolved only in blood, doesn't go to the brain. Can all drug go to the brain? May not be. Now, what is the volume of the body in which the drug is going to get dissolved? It is what is called a volume of distribution. Now, what are the factors on which this depends upon? Because every drug has got different volume. VOD it is called a volume of distribution. VOD. So, what are the factors which on which this depends upon? Time factors are still. Now, weight of the person. तो body का volume ना see, volume of this. I am talking about different drugs given the same patient. If the volume of the patient itself is small, of course volume is going to be smaller. But that will be a patient variation. I am talking about the same drug given to the same different drug given to the same patient. Every drug dissolved in different volumes because every drug has got different molecular weight. Let me give an example so that we can understand it here. Let me give an example. Let's say molecular weight of the drug. Let's say these are the cells and this is what is the blood. Now, if drug has got very huge molecular weight, now for the drug to come out of the vessels, it need to come from the spores of, or I can say the openings of the blood vessels. If the molecular weight is large, can it come out? It will not come out. So, if the molecular weight is huge, the volume of distribution is less क्योंकि वो blood vessel से बाहर ही नहीं आएगी. Or if it is very small particle, let's say very small, it will come out of the cells. It may also even go into the cells. क्योंकि उसका permeability क्या हो जाएगा? ज़्यादा. The drug is going to be more permeable. If the drug is more permeable, it will have a larger volumes. मतलब वो ज़्यादा बॉडी में ही रहेगा, लेकिन हर एक सेल के अंदर घुसेगा अंदर. That is the reason molecular weight is an important which is inversely proportional. Larger is the molecular weight, smaller is the volume of distribution, or smaller is the molecular weight, larger is the volume of distribution. That is what is the first point called as molecular weight. What is the other property which decides the volume of distribution is lipid solubility. Remember, this is very commonly asked in the Vivas. What are the factors? Now, मगाचे factor वेगळे होते हैं. Factors which determine the absorption. These are the factors that determine the distribution. Factors that determine the distribution. Here, the second important factor is the lipid solubility. What is that? Lipid solubility. That means drug's ability to dissolve in the lipids. Why this is important? Because for the drug to go into the cell, it has to go through the cell wall. Now, cell walls are made up of what? Cell walls are made up of lipids. Remember glycolipids and glycoproteins. So cell wall is made up of lipids. For the drug to go into the cell, it has to go through the lipids. That means it should have an ability to dissolve or become soluble in the lipids. For example, drug is in the water form. Water and oil, can they mix with each other? No. So the drug is lipid insoluble form. It won't be able to go into the cell. So if you want drug to go into the cell, you will have to make the drug in the lipid soluble form. So lipid solubility decides whether the drug will go in the cell or remain outside the cell. If you want drug to be there only in the interstitial space, make the drug lipid insoluble. If you want the drug to go into the cell, make the drug lipid soluble. So lipid solubility काय करेल? Volume of distribution वाढवेल की कमी करेल? Directly proportional. More is the lipid solubility, more will be the it will be directly proportional. It will be directly proportional. More is the lipid solubility, more will be the drug distribution. More will be the drug distribution. Lipid solubility more, distribution of the drug is also more. What is the third one that is also more important is the pH of the drug. It's the pH of the drug. Because different body cavities have got different pH. So depending upon that, the distribution is going to be less or more. Fourth important thing is ability to cross. Do we have some barriers in the body? Blood-brain barrier. The ability of the drug to cross blood-brain barriers. So there are a few drugs which can pass, there are some of the drugs which cannot pass. So if you are asked about what exactly decides the distribution of the drug, is these are the points. Molecular weight, lipid solubility, pH, as well as ability to cross the blood-brain barriers. What is blood-brain barrier means? I exactly asked you. What do you mean by blood-brain barrier? What exactly it is? Because we all know brain is the most important organ we have. So any chemical which is there in the body doesn't reach up to the brain. The reason behind that, the capillaries of the brain, let's say this is what is the brain, spinal cord. The capillaries which are there in the brain are coated with some cells. कुठले cells आहेत? They have a neuroglial cells. So that the drug may remain in the capillary, परंतु त्याला ब्रेनवर ऍक्शन करायची असेल तर त्याला बाहेर यावं लागेल ना. See, the drug is there in the capillaries, but for the drug to act on the neurons, it should come out of the capillaries, right? So capillaries are coated with the neuroglial cells. हे ब्लू कलर जे आहेत त्याला ग्लायल सेल्स म्हणतात, which is only there in the brain. So not all chemicals which are there in the circulation which can come out of the capillaries. सगळे chemical बाहेर येऊ शकणार नाही. Only some of the chemicals which can come out and can act on the brain. So if you want drug to be able to act on the brain, you will have to create a drug which is going to cross the blood-brain barrier. So not all drugs, only few of the drugs can cross the blood-brain barrier. So that also decides the volume of distribution. Why is the volume important? Because remember, it is the volume. प्रत्येक ड्रगचं काय व्हॉल्यूम वेगवेगळं, राईट? Every drug has got different molecular weight, different lipid solubility, different pH, and ability to cross the blood-brain barrier. So every drug has got different volume. And in how much volume drug is going to get dissolved, that decides the dose of the drug. नाही कळलं? That decides the dose of the drug. Let's say, for example, there is drug A and there is drug B. Drug A has got 20 liters as a volume of distribution in the body. Drug B has got 10 liters. If you want to have equal concentration of both the drugs, कोणता डोस जास्ती लागेल? डोस कोणाचा जास्ती लागेल? सी ए ड्रग किती व्हॉल्यूम मध्ये डिझॉल्व होत आहे? 20 लिटर. बी ड्रग 10 लिटर. लेट मी हॅव सिंपल एक्झाम्पल. हे थोडं डिफिकल्ट वाटत असेल तर I have got two glasses. This is about 20 liter. This is about. I have got two drugs, drug A and drug B. दोघांचं कॉन्सन्ट्रेशन याच्यामध्ये याचा व्हॉल्यूम किती आहे? 20 लिटर. याचा व्हॉल्यूम किती आहे? दोघांचं कॉन्सन्ट्रेशन सारखं व्हायला कोणतं ड्रग मला जास्त द्यावं लागेल? कॉन्सन्ट्रेशन म्हणजे काय की एका एम एल मध्ये किती ड्रग आहे? कॉन्सन्ट्रेशन इज व्हॉट? एका एम एल मध्ये किती ड्रग आहे? तर कुठलं ड्रग मला जास्ती द्यावं लागेल की जे ड्रग 20 लिटर मध्ये डिझॉल्व होते की 10 लिटर मध्ये डिझॉल्व होतं? 20 मध्ये. लेट्स हॅव अ सिम्पलर एक्झाम्पल. These are the two bottles of water. If I am supposed to put ink in both the bottles, in which bottle I will have to put more ink for the same concentration of the ink? 20. So larger is the volume of distribution, larger is the dose required of the drug. कारण ऍक्शन कोणामुळे येते? कॉन्सन्ट्रेशन मुळे येते. Drug has to cross certain concentration in the body. So larger is the volume, larger will be. तुम्हाला समजा 5 जणांचा सरबत बनवायचं आहे तर तुम्हाला मोठं भांडं घ्यावं लागेल. तर तेवढंच तुम्हाला जास्त साखर टाकावी लागेल, जास्त लिंबू टाकावं लागेल. एक ग्लास जरी बनवाल तरी त्याचं कॉन्सन्ट्रेशन सेम असणार आहे. तुम्ही एकाच ग्लासमध्ये 5 लिंबू नाही टाकणार, पण 5 ग्लासमध्ये 5 लिंबू टाकणार. सिमिलरली इट इज द बिकॉज दिस हॅज गॉट एन ऍप्लिकेशन. फक्त हे काही कन्सेप्ट नाही, याचा पुढे यूज आहे. सो दिस व्हॉल्यूम ऑफ डिस्ट्रीब्युशन डिसाइड्स द डोस ऑफ द ड्रग. जेवढा जास्त व्हॉल्यूम मध्ये ड्रग डिझॉल्व्ह होणार आहे तेवढा जास्त डोस लागेल, तेवढा जास्ती डोस लागणार. लक्षात आलं? There are a few now. There's one more very important concept in this, which is also very commonly asked in the exams, and is the most difficult to understand. But if you understand the basics, it remains very simple. When the drug is distributed in the body, आपण कुठपर्यंत पोहोचलोय? We started from dissolution, absorption. Then we discussed about first pass metabolism, and we also discussed about the factors determining the absorption. Then we discussed about bioavailability. Then we discussed about distribution, bioequivalent, and then we discussed about distribution. आपण जो distribution मध्ये जाऊ. In the distribution, some drugs has got an important property of there is something called plasma protein binding. बरेचदा this is the question that is asked in the Viva. What is the importance of plasma protein binding of the drug? Or what will happen when the drug is bound to plasma proteins? Plasma proteins कुठे आहेत? Plasma मध्ये, blood मध्ये. Blood has got cells and plasma. Plasma has got some proteins. कुठले आहेत ते? Albumin, globulin and fibrinogen. We have 3 types of proteins. We have albumin, globulin and fibrinogen. त्याच्यामध्ये बाइंडिंग प्रोटीन जे आहेत ते अल्ब्युमिन अँड फायब्रिनोजन काय? इज अ कोएगुलेशन फॅक्टर दॅट डज दिस. हे सगळे प्रोटीन्स कुठे आहेत? ब्लड मध्ये ना, ब्लड has got two components, cells and plasma. या प्लाझ्मा मध्ये सगळे काय आहे? Plasma protein. So wherever there is a blood, there is a plasma protein. There are a few drugs which are bound to plasma proteins after they are distributed. त्यामुळे ही concept कधी येणार? Before distribution or after distribution? After distribution. Because when the drug will be distributed in the body, who is going to distribute the blood? The drug is blood only. How does drug go all over body? Do we have a duct? We have only blood as a medium that distributes the drug all over body. So when the drug goes to the blood, it may also bound to the albumin globulin. And what happens because of that? That is what is the concept right now. कुठला concept आहे तो? Is a plasma protein binding. What will happen when the drug is bound to a plasma protein? That means drug after getting distributed bound to albumin or globulin. काय होणार? When the drug is bound to albumin and globulin, first thing what is going to happen is it is not going to act on the body. का? ड्रग बॉडी मध्ये असेल पण तो ऍक्ट होणार नाही. बिकॉज when the drug is bound to the plasma proteins, now remember आपल्याला फार्माकोडायनॅमिक मध्ये येईल, मोस्ट इम्पॉर्टंट मेकॅनिझम ऑफ द ड्रग इज थ्रू रिसेप्टर्स. ड्रग रिसेप्टरवर बसायला पाहिजे, पण तो जर कोणाला बाउंड झालाय तर तो बसू शकणार नाही. सो फर्स्ट थिंग व्हॉट हॅपन्स इज ड्रग डजंट ऍक्ट ऑन द बॉडी. Second important point, the drug remains only in blood. ड्रग दुसरीकडे कुठेच जाणार नाही. कॅन द ड्रग गो इन टू द सेल? तो अल्ब्युमिनला बाउंड आहे. अल्ब्युमिनचं मॉलिक्युलर ओनली 50,000 इज अ मॉलिक्युलर वेट. So that drug is bound to the albumin, molecular weight of the complex increases much more. It doesn't go out of the blood vessels. मतलब है तुम्हाला larger drug का volume molecular weight में भी small है, पण drug ने काय केलंय? Is bound to the plasma protein. हा plasma protein है. त्यामुळे this complex has got much more molecular weight. त्यामुळे it is not going to go out of the blood vessel. It remains in the blood only. म्हणून तो सेलकडे जात नाही आणि म्हणून तो ऍक्ट पण होणार नाही. What will further happen? Will the drug be excreted by the body? Do we have albumin excreted by the body? In urine, but normally or abnormally? Abnormally. Normal patient, we don't have drug, we don't have protein. In fact, we preserve proteins. Albuminuria, proteinuria is only in pathological conditions, not in normal conditions. So when the albumin is not excreted by the body, will the drug be excreted? Drug will also not be excreted. Drug will also not be excreted by the body. आणि यामुळे even if you give drug, sometimes तुम्ही म्हणाल की बाबा ड्रग दिलंय, if you do the blood concentration of the drug, ब्लड मध्ये ड्रग असेल ना, पण ते ऍक्ट होणार नाही. दॅट मीन्स ब्लड कॉन्सन्ट्रेशन विल बी देअर, but the action will not be there. याचं एक सिंपल ऍप्लिकेशन काय, यू मस्ट हॅव बीन हर्ड अबाउट, जेव्हा आपण थायरॉइड फंक्शन टेस्ट करतो तेव्हा फक्त T3 T4 नाही करत, फ्री T3 and फ्री T4 करतो. व्हॉट इज फ्री T3 and फ्री T4? कारण T3 T4 इज ऑल्सो बाउंड टू अल्ब्युमिन, परंतु जे ऍक्शन करणारे T3 T4 आहे हे बाउंड नसलेले ऍक्शन करतात, बाउंड असलेले ऍक्शन करणार नाही. So if you want to know exactly whether the patient is having hypothyroid or hypothyroid symptoms properly, you should be also be able to measure the free T3 T4, not the bound to the T3 T4. That is free T3 and T4. Free T3 T4 म्हणजे काय? The T3 T4 which is available for an action. Available for an action. Normally काय असतं, 80% T3 T4 bound असतो, 20% free असतो. 20% free असतो. Because of binding to the plasma proteins. हे लक्षात येते? थोडं डिफिकल्ट आहे. सगळ्यात पहिले काय आहे, when the drug is bound to plasma protein, what will happen? Drug is not going to act on the body. Drug is going to remain in the blood as a compartment. Drug will also not be excreted by the body. Drug will also, पुढचा काय पॉइंट होता?
Action will not take.
Action will not take place. This drug will also take part into drug interactions. कसं काय? Will take part into drug interactions.
It will bond with some other drug, then act.
ते otherwise पण होणार. What will happen because of plasma protein binding? हा एक खूप डिफिकल्ट कन्सेप्ट आहे, खूप इंटरेस्टिंग आहे. हे सगळं मी इरेज करतो आता. लेट्स सी वेअर आर वी राईट नाउ. सी ही ड्रग इंटरॅक्शन एक्झॅक्टली कशी काय होते? लेट्स से बॉडीमध्ये 10 प्लाझ्मा प्रोटीन माझ्याकडे आहेत. किती किती प्लाझ्मा प्रोटीन आहे? 10. मी एक पेन किलर देतो. मी एक काय दिलं? पेन किलर दिलं की ते पेन किलर जे आहे ते 50% प्लाझ्मा प्रोटीन बाउंड आहे. म्हणजे ऍक्शन किती पर्सेंटची होईल? 50%. लेट्स से आय हॅव गिवन 10 मॉलिक्युल्स ऑफ पेन किलर. म्हणजे हे ब्लू कलरचं पेन किलर जे आहे, हे 5 पेन किलर जे आहे ते प्लाझ्मा प्रोटीनला बाउंड होतील आणि ऍक्शन कोणाची मिळेल? ओन्ली हे बाहेरचे 5. बाहेरचे 5. समजा मी दुसरं ड्रग दिलं पेशंटला. पेशंट कम्स टू यू विथ कन्व्हल्जन्स. आणि दुसरं ड्रग जे आहे, लेट्स से दिस ड्रग इज ग्रीन इन कलर. येस, हे 80% प्लाझ्मा प्रोटीन बाउंड आहे. म्हणजे किती ड्रगची ऍक्शन होणार?
20%.
ओन्ली 20%. सो हे ड्रग जेव्हा मी देणार 10 मॉलिक्युल्स हिरवा, तेव्हा 8 मॉलिक्युल प्लाझ्मा प्रोटीनला बाउंड व्हायला होतील. म्हणजे मी अंदाज कसा केला की 10 मॉलिक्युल दिले तर 2 मॉलिक्युलची ऍक्शन होणार, बरोबर? म्हणून मी त्यानुसार डोस ठरवला, बरोबर? 2 मॉलिक्युल. समजा पेशंट ऑलरेडी हा ड्रग घेत होता, त्याने अर्धे प्लाझ्मा प्रोटीन ऑक्युपाय करून ठेवले होते, तर या पुढच्या ड्रगला किती मॉलिक्युल मिळतील? 5च मिळतील. प्लाझ्मा प्रोटीन आपल्याकडे भरपूर नाही आहेत, थोडेच आहेत. म्हणजे जे 2 मॉलिक्युलची ऍक्शन होणार होती नॉर्मली, ती आता किती मॉलिक्युलची होणार? 5ची होणार. म्हणजे तुम्ही सेम डोस जरी दिला तरी पेशंटला ऍडव्हर्स इफेक्ट येतील. लक्षात येत आहे? याचंच ऍप्लिकेशन आहे. तुम्ही म्हणाल की नाही मी 20 मिलीग्रामच दिला तरी पेशंट झोपला, उठलाच नाही. आय एम राईट, यू विल बी राईट, बट यू डिड नॉट टेक द हिस्ट्री वेदर पेशंट इज टेकिंग अदर ड्रग और नॉट. कारण हे कधी होणार? जेव्हा तो दुसरा ड्रग घेत असेल तर ना. ड्रग इंटरॅक्शन म्हटलं ना मी. पेशंट इज गोइंग टू प्रोड्यूस. किंवा असं पण होऊ शकतं की हा ड्रग जर स्ट्रॉंग असेल, याची प्लाझ्मा प्रोटीन बाइंडिंग, हा ड्रग काय करेल, यांना उचलेल इकडनं, मला बसू दे. म्हणजे याची ऍक्शन तेवढीच होईल पण याचा ओव्हरडोस होऊन जाईल. समजा इट डिपेंड्स अपॉन कोण स्ट्रॉंग आहे. समजा आपल्याकडे एकच बेंच आहे बसायला आणि एक संगीत खुर्चीमध्ये एक धडधाकट माणूस आहे आणि एक बारीक माणूस आहे, कोण बसणार खुर्चीवर? धडधाकट बसतो, त्याला धक्का मारून बसून जाईल. सिमिलरली या दोघांमध्ये कोणाची पॉवर जास्ती आहे त्यानुसार तो समोर त्याला उचलेल आणि स्वतः बसेल. एक प्लाझ्मा प्रोटीन एका वेळेस एकच ड्रग कॅरी करू शकतो. त्यामुळे एक तर याची रिएक्शन होईल किंवा this is what is the last point of the importance of what? Plasma protein binding. The most difficult in the book. But if you understand properly की हे याच्यामुळे काय होणार, it becomes very easy to understand. अजून कुठल्या कंडिशन मध्ये आपण केअरफुल राहायला पाहिजे? Let's say even if not a drug interaction, हे इथपर्यंत तुम्हाला कळलं? Let's say some patient, there are 2 patients. याचंच ऍप्लिकेशन आहे. See, जनरल फार्माकोलॉजी you will have to apply it in the pharmacology. तरच तुम्हाला ते लक्षात राहणार. There are 2 patients, A and B. दोघांमध्ये मी सेम ड्रग दिलं X. सेम ड्रग, सेम कॉन्सन्ट्रेट, सेम डोस, दोघांचा वेट सारखा आहे. याचं पण 60 किलो, याचं पण वजन 60 किलो. आयडियली बघायला गेलो तर दोघांमध्ये सारखी ऍक्शन व्हायला पाहिजे. ड्रग सेम आहे, डोस सेम आहे, यांचा व्हॉल्यूम पण सेम आहे. हे ड्रग जे आहे हे प्लाझ्मा प्रोटीन बाउंड आहे. परंतु बी पेशंट जो आहे, बी पेशंट इज अ पेशंट ऑफ प्रोटीन्युरिया. त्याला प्रोटीन्स तो लूज करतोय, इज लुजिंग प्रोटीन. सो याच्यामध्ये सिरम प्रोटीन लेवल जे आहेत हे लो आहे. जो पेशंट प्रोटीन्स लूज करतोय त्याच्यामध्ये ब्लड प्रोटीन लेवल्स विल बी लेस. So this patient has got only 3 molecules of protein. This patient has got normal molecules of protein, which are 10. सेम डोस दिला, सेम बॉडी वेट असेल, ज्याच्याकडे प्रोटीन्स कमी आहेत त्या पेशंट मध्ये ड्रगला अल्ब्युमिन बाउंड करायला कमी मिळतील. त्यामुळे हे ड्रग चा फ्री फॉर्म जास्ती होईल. लेट्स से हा ड्रग जो आहे हा 50% प्रोटीन बाउंड आहे. म्हणजे या पेशंट मध्ये 5 ला तो प्रोटीन बाउंड होईल आणि 5 मोकळा राहील. ऍक्शन कितीची होईल? 500 ऍक्शन होईल. बरोबर. पण या पेशंट मध्ये त्याच्याकडे 3च प्लाझ्मा प्रोटीन आहे. म्हणजे ऍक्शन कितीची होईल? ऍक्शन कितीची नॉर्मली व्हायला पाहिजे? 500 होईल. तुम्ही जर ब्लड लेवल बघाल दोघांमध्ये सारखे मिळेल. याला का ओव्हरडोस झाला? प्रोटीन कमी होता. He had less protein and because of that he has got overdose. ड्रग तेच दिलं, बॉडी वेट पण सेम आहे. So of course only for those drugs which are especially plasma protein bound we should be more careful about. We should be more careful about. Now this becomes a property of binding to the plasma protein binding. Plasma protein binding. लक्षात आलं? आपण कुठल्या पॉइंटवर आहोत? Distribution. Distribution. What are the factors that determine the distribution? कुठले होते the factors? Molecular weight, lipid solubility, pH and ability to cross the blood-brain barrier. Now remember हे distribute झाल्यानंतर after the distribution it is a possibility not for the all drugs that drugs after the distribution it is a possibility that molecular weight of the drug, lipid solubility of the drug may change. होऊ शकतं असं की डिस्ट्रीब्यूट झाल्यानंतर एक मॉलिक्युलर वेट त्याचा चेंज झाला. लेट्स से फॉर एक्झाम्पल हा डिस्ट्रीब्यूट झालेला ड्रग आहे. इट इज अ पॉसिबिलिटी दॅट some molecule get added to the drug. It is a possibility that some molecule will be removed from the drug. कारण त्याच्यावर ब्लडचे एन्झाइम्स ऍड करतील, सेल्सचे एन्झाइम ऍड करतील. So after distribution, only for some drugs, it is a possibility that it may change their molecular weight, change their lipid solubility. And हे जर झालं, then the drug will be, हे सगळं चेंज झालं ना, मग लगेच पुन्हा ड्रग अजून जास्ती व्हॉल्यूम मध्ये डिस्ट्रीब्यूट होणार, ते जे कमी व्हॉल्यूम मध्ये डिस्ट्रीब्यूट झालं होतं अगोदर, कारण त्याचं मॉलिक्युलर वेट चेंज झालं किंवा कमी झालं. दॅट इज व्हॉट इज कॉल्ड एज रिडिस्ट्रीब्युशन. दॅट इज व्हॉट इज कॉल्ड एज. आता हे रिडिस्ट्रीब्युशन फक्त काही ड्रगच आहे, सगळ्या ड्रगचं नाही. बट यू अंडरस्टँड देयर इज अ रिडिस्ट्रीब्युशन काइंड ऑफ आफ्टर VOD, volume of distribution, the drugs are redistributed or drugs are again distributed to other compartments, called as redistribution. हा पाचवा पॉइंट होता, राईट? त्याच्यामध्येच हा पॉइंट येईल आणि त्याच्यामध्येच हा पॉइंट येईल, प्लाझ्मा प्रोटीन बाइंडिंग. विल बी देयर इन द सेम पॉइंट. आता डिस्ट्रीब्यूट झाल्यानंतर काय होईल? द ड्रग इज गोइंग टू ऍक्ट ऑन द बॉडी. मी जर समजा पेन किलर घेतलाय, somebody has got a wrist joint pain. So when I take the drug will be distributed, and then the drug reaches here, then the drug is going to act on the body. बरोबर. पण ऍक्शन आपण थोड्या वेळाने घेऊ. ऍक्शन इज अ सेपरेट कन्सेप्ट. यामध्ये काय होतंय, ड्रग ओरली घेतलं, स्टमक मध्ये गेलं, लिव्हर कडे गेलं, ऑल ओव्हर बॉडी गेलं आणि त्याचं रिडिस्ट्रीब्युशन झालं. म्हणजे इफ यू सी इनडायरेक्टली what are we doing, this particular concept is concept of pharmaco काय कायनेटिक्स. इनडायरेक्टली तुम्हाला जर फार्माकोकायनेटिक विचारलं तर हेच सगळं लिहायचं. इट्स एन एलएक्यू, लॉंग आन्सर क्वेश्चन. फार्माको, what is kinetic means? It's a movement. Kinetic is movement. So kinesis is a movement. That means this is the mechanism by which drug is moving in the body from one place to the other place. And drug is going to act on the body. त्याला काय म्हणतात? Dynamics. Indirectly, kinetic is what body does to the drug, and dynamic is what drug does to the body. If you see absorption of the drug, distribution of the drug, first pass metabolism, हे सगळं कोण करते? ड्रग बॉडीला करते की बॉडी ड्रगला करते? डिस्ट्रीब्यूशन कौन करता है? फर्स्ट पास मेटाबॉलिज्म कौन करता है? बॉडी करता है. So this is what is pharmacokinetic. So drug is distributed, then dynamic will happen. पण हे आपण separately discuss करू. Let's first discuss the other part of the kinetic. Distribute झाल्यानंतर काय होईल? Drug will also move through kidney, sweat glands, skin, even lungs. What are these organs? Excretory organs. Will the drug again go to liver? लिव्हर कडे जाऊ ना एकदा, पुन्हा लिव्हर कडे जाईल. पहिल्यांदा लिव्हर कडे कशामुळे गेला होता? कोणाच्या थ्रू गेला होता? पोर्टल सर्क्युलेशन. पण आता ड्रग डिस्ट्रीब्यूट झालाय, पण डिस्ट्रीब्यूट झालेला ब्लड कुठे आहे? ब्लड मध्ये ना, पुन्हा लिव्हर कडे नाही ना. का? हेपॅटिक आर्टरी आर्टेरियल सर्क्युलेशन मध्ये गेला तर लिव्हरला पुन्हा ब्लड सप्लाय मिळेल ना आर्टेरियल सर्क्युलेशनचा. सो इट विल अगेन कम टू द लिव्हर बट थ्रू अदर रूट. मागच्या दार, अगोदर हे मागचं दार होतं, ते पुढचं दार आहे. रिमेंबर, लिव्हर हॅज गॉट डबल ब्लड सप्लाय, फर्स्ट थ्रू पोर्टल सर्क्युलेशन, द अदर थ्रू हेपॅटिक आर्टरी. अँड बिकॉज ऑफ दॅट पहिल्याला काय म्हटलं होतं आपण? फर्स्ट पास मेटाबॉलिझम. देयर कॅनॉट बी अ फर्स्ट पास मेटाबॉलिझम इफ देयर इज नो सेकंड पास. फर्स्ट पास मी कधी म्हणणार? जेव्हा सेकंड पास असेल तरच म्हणणार ना. तर सेकंड पास नसतीच तर फर्स्ट पास म्हटलंच नसतं ना, फक्त मेटाबॉलिझम म्हटलं असतं मी. सो अगेन विल कम टू लिव्हर, but this time through hepatic artery, that time to portal circulation. So when the drug is moving through all these organs, drug will obviously be excreted by the body. Drug will no longer remain in the body when the drug moves through these organs. And कशा प्रकारे किंवा कोणत्या रेंज? नाव लॉजिक काय म्हणतंय की जेवढं जास्ती ड्रग किडनीकडे जाईल किंवा लिव्हरकडे जाईल त्या प्रोपोर्शनेटली तेवढं जास्त ड्रग एक्सक्रीट होणार. लिव्हरकडे जेवढं ड्रग गेलं त्याचा 80% त्याने कापलं ना पहिले, जेवढं जास्त गेलं तेवढं जास्त कापणार तो. सो रिमेंबर, याच्यामध्ये कन्सेप्ट आहे समथिंग कॉल्ड कायनेटिक्स ऑफ एलिमिनेशन. The concept called as kinetics of elimination. That means how exactly drugs are eliminated, or how exactly the mechanism by which drugs are eliminated. Kinetics of elimination. त्याच्यामध्ये दोन concepts आहेत. There are two ways. One is called as an first order kinetic and the other is called as zero order kinetic. वाचलंय? What is first order then? What is your first order?
amount of drug which is in the plasma concentration, the same amount is eliminated.
Then it total 100%.
Clearance remains constant. Same amount is.
You are almost there. Almost पोहोचलात. मी लॉजिक काय म्हटलं की फॉर एक्झाम्पल फर्स्ट पास मेटाबॉलिझम मध्ये लिव्हरने किती घालवलं ड्रग, म्हणजे लेट्स से 100 मिलीग्रॅम दिलं तर किती घालवलं 80. 200 दिलं तर जेवढं जास्त ड्रग लिव्हर कडे जाईल तेवढं जास्त ड्रग लिव्हर मेटाबोलाइज करेल, बरोबर. सो मोस्ट ऑफ द ड्रग्स, हे मी म्हटलं की अमाऊंट ऑफ ड्रग eliminated is directly proportional to concentration of. रिमेंबर जसं फर्स्ट पास मध्ये झालं तसं सेकंड पास मध्ये पण होणार. अल्टिमेटली कोणाकडे जातं ते लिव्हर कडे जात आहे. सो इफ द 100 मिलीग्राम गोज टू लिव्हर इट एलिमिनेट्स 200 goes. That means amount of drug metabolized depends upon what? Amount of drug which is going to the liver or not. That means elimination will also be directly proportional to concentration. That means higher is the concentration, higher will be elimination. आता हे एवढं डिफिकल्ट आहे का अंडरस्टँड करणं? नाही डिफिकल्ट आहे, पण याचं ऍप्लिकेशन इज व्हेरी डिफिकल्ट. कारण फक्त कन्सेप्ट लक्षात घेऊन उपयोग नाहीये. आपण आतापर्यंत जे पण शिकलो मोस्ट ऑफ द टाइम फक्त कन्सेप्ट शिकलो 10वी-12वी पर्यंत. ऍप्लिकेशन शिकलो का? खरंच ऍप्लिकेशन काय ग्रॅव्हिटेशनल फोर्सचा फिजिक्स मध्ये होता तो कोणालाच नाही. खरंच ऍप्लिकेशन काय डेरिव्हेटिव्ह इंटिग्रेशनचा मॅथमॅटिक्स कोणालाच नाही. सर्क्युलर मोशन, रोटेशनल मोशन, हायपरबोला, पॅराबोला कोणालाच माहित नाही. आणि कोणी सांगतच नाही ऍप्लिकेशन. ऍप्लिकेशन सांगितलं तर इंटरेस्ट डेव्हलप होणार, नाहीतर इंटरेस्ट डेव्हलप होणारच नाही. आणि म्हणून आपल्याकडे एज्युकेशन, आपलं ब्रेन पॉवर खूप चांगली इंडियन्सची, पण रिसर्च का होत नाही? वाय मोर रिसर्च इज हॅपनिंग आउटसाइड? बिकॉज दे यूज ओनली ऍप्लिकेशन. ते फक्त अप्लाय करतात की बाय कॉमन सेन्स. ते एवढं डिफिकल्ट नाही, पण यालाच अप्लाय करून एक कन्सेप्ट बाहेर येते, त्याला म्हणतात हाफ लाईफ. म्हणजे लेट्स से अगोदर तुम्हाला दुसरं सांगून होतं, मग आपण पुढे जाऊया. फर्स्ट ऑर्डर कायनेटिक मध्ये काय झालं होतं? अमाऊंट ऑफ ड्रग एलिमिनेटेड विल बी proportional to concentration. म्हणजे हायर इज द कॉन्सन्ट्रेशन, एलिमिनेशन. झिरो ऑर्डर मध्ये काय होतं? अमाऊंट ऑफ ड्रग एलिमिनेटेड इज कॉन्स्टंट whatever is the concentration. Whatsoever 90% drugs eliminated by only 10%, or I can say less than 10%, eliminated by zero order kinetic. by zero order kinetic. म्हणजेच काय? एक लक्षात घ्या. लेट्स से फॉर एक्झाम्पल, लेट्स से फर्स्ट ऑर्डर कायनेटिक आपण डिस्कस करूया. लेट्स से मी कुठलं ड्रग दिलं ए. I'm talking about first order kinetic right now, and the concentration of the drug is, let's say, 100 milligram. Concentration of drug किती आहे? 100 milligram, and liver or its body excretes 10% of the drug per hour. एका तासामध्ये किती एलिमेंट करते? 10%. म्हणजे ज्या ड्रगचं कॉन्सन्ट्रेशन 100 आहे, एक तासानंतर ते किती होईल? 10% एलिमिनेट होणार ना. म्हणजे 100 चे 10% एलिमिनेट होणार, किती होणार? 90. दुसऱ्या तासाला किती होईल? नाही. आता म्हणजे किती? याच्यामध्ये 10 एलिमिनेट झालं, आता कॉन्सन्ट्रेशन किती झालं? मग आता एलिमेंट किती होईल? 90च्या 10% ना. अमाऊंट ऑफ ड्रग एलिमिनेटेड इज प्रोपोर्शनल टू कॉन्सन्ट्रेशन. अगोदर किती होतं? 100. म्हणजे किती एलिमिनेट झालं? 10. आता किती झालं? 90. मग आता किती एलिमिनेट होईल? लक्षात आलं? 81. तर जसं कॉन्सन्ट्रेशन कमी होत जाईल तसं एलिमिनेशन पण तिसऱ्या तासाला किती होईल? -8.1 बरोबर. इट बिकम समथिंग अराउंड 73. चौथ्या, पाचव्या किंवा लेट्स से 6व्या तासाला ते होतं 50. आपण एक अंदाज करूया. यालाच कंटिन्यू मॅथमॅटिकली मी जाऊ शकतो, पण आपण सगळे वी आर व्हेरी पुअर इन मॅथमॅटिक्स अँड बिकॉज ऑफ दॅट वी चोज मेडिकल ॲज अ फील्ड, राईट. सो लेट्स से 6व्या तासाला ते किती झालं? अंदाजे होईल. एक्झॅक्टली 5 तास नाही लागणार, थोडा जास्त वेळ लागेल, कारण हळूहळू एलिमिनेशन पण कमी कमी होईल. म्हणजे 6 तासांनी कॉन्सन्ट्रेशन 100चं किती झालं? 50. बरोबर. हाफ झालं. मुद्दाम थांबलो मी इथे. लेट्स से आय गिव्ह द सेम ड्रग, लेट्स से सेम ड्रग बट इन हायर डोज, लेट्स से 1000 मिलीग्रॅम. आता हेच फॉर्म्युला वापरला तर काय? पहिल्या तासाला किती होईल? पहिल्या तासाला एलिमिनेट किती होईल? एलिमिनेट 100 होईल, म्हणजे होईल कॉन्सन्ट्रेशन किती? दुसऱ्या तासाला? सहाव्या तासाला? हेच जर का समजा मी एकदम कमी कॉन्सन्ट्रेशन दिलं, लेट्स से 10 मिलीग्रॅम, सेम ड्रग, आता याच्या 10% ना, म्हणजे 10 तर 10% इज 1, म्हणजे 1 एलिमिनेट होईल. उरेल किती? दुसऱ्या तासाला? मी मॅथमॅटिक्स नाही शिकवत आहे, परंतु कन्सेप्ट लक्षात घ्या. म्हणजेच मी काय म्हटलंय, व्हॉट एव्हर इज द कॉन्सन्ट्रेशन ऑफ द ड्रग, it requires same time to reduce the concentration to half. कारण elimination proportional to concentration. Whatsoever is the concentration of the drug. Even you may also take any odd concentration, 7500. It takes same amount of time to reduce it to 3750. यालाच म्हणतात हाफ लाईफ. हाफ लाईफ ही फक्त फर्स्ट ऑर्डर कायनेटिकचीच असू शकते. सेकंड ऑर्डर कायनेटिक मध्ये हाफ लाईफ नसते. आपण आता हे सेम प्रिन्सिपल आपण 0 ऑर्डर मध्ये पण करूया, पण त्याच्या अगोदर मला हाफ लाईफची डेफिनेशन सांगा काय असेल ती. कळलंय हाफ लाईफ काय? काय हाफ लाईफ? अंदाजे ढोबळ मनाने किंवा what is half life? Half life is the time required by the body to reduce the concentration to half of the original concentration. The time required. Half life त्याचा फॉर्म्युलाच काय? T half. असंच म्हणतो ना आपण. So half life is the time required by the body to reduce the concentration to half of the original concentration. Of the original concentration. And this may be different for all the drugs. कारण का? Every drug is a different chemical managed by the body differently. त्याच्यामध्ये लॉजिक काय आहे की नॉर्मली by and large we are supposed to repeat the drug at the drug's half life. म्हणजेच काय होतं, same steady concentration is maintained in the blood. Let's say some drug has got 6 hours as a half life. I'm going to repeat the drug 4 times in a day. Some drug has got 12 hours as a half life. I'm repeating the drug twice in a day. Some drug has got 24 hours as a half life. I'm going to use once in a day. Once. Can you manipulate this? काय केलंय? Listen, याचं एक अजून एक ऍप्लिकेशन आहे. हे इथपर्यंत लक्षात आलं? So how will you define half life? It's a time to reduce the concentration to half. To reduce the concentration to half. म्हणजेच लेट्स से 6 hours हाफ लाईफ असेल, तुम्ही किती फ्रिक्वेंटली देणार त्याला? 4 times. 12. And this is by and large. This is not compulsory, but usually 2 times. 24 hours the center? Once. 8 hours the center?
3 times.
4 hours the center?
6 times.
2 hours the center?
2
Is it for the oral only or intramuscular also? आता अप्लाय करा का इंटरमस्क्युलरला नको हाफ लाईफ कधी होते ऍब्झॉर्ब झाल्यानंतर ना एलिमिनेट कधी होतं डिस्ट्रीब्यूट झाल्यानंतर मग इंटरमस्क्युलर डिस्ट्रीब्यूट नाही होत so diclofenac sodium as a tablet you give twice in a day orally. If you want to give intramuscularly you also give twice in a day. It is also the same augmentin injection thrice in a day देतो ना आपण injection that is tablet thrice in a day injection also twice in a day or thrice in a day sometimes. So this applies to all the routes but इथपर्यंत it is okay. Can you give a drug 6 times in a day 12 times? We have got some drug which has got 3 minutes as a half life 10 minute. We have got few drugs which has got 10 seconds as a half life. आता हे कसं देणार ठीक आहे इथपर्यंत आपण जात नाही सध्या इथे लक्षात घ्या हे हाऊ विल यू गिव्ह दिस ड्रग 6 times in a day? Can the patient take 2 drugs 2 tablet 3 times in a day? चालेल टोटल दिवसभरात किती गोळ्या पाहिजे दिवसभरात किती गोळ्या घ्यायच्या 6 tablets. He says I will take 2 tablets 3 times in a day. 6 गोळ्या होतील ना चालेल का का let's make it simple. Patient says this is a drug you are supposed to give 2 times in a day. वो बोलेगा कि दोपहर को in the afternoon I am not free, I am going to be there in the college and the class, I won't be able to take time to take the tablet. So can I take 2 tablets in the morning itself so that it is going to last for the whole day? का त्याचं ऍप्लिकेशन हेच आहे डबल डोस घेतला तर दोघं ड्रग ऍब्झॉर्ब होतील दोघं ड्रग एलिमिनेट पण लवकर होतील ना कारण अमाऊंट ऑफ एलिमिनेशन so he will not be able to manipulate this. Crocin for example you are supposed to give 625 milligram or 650 milligram 3 times in a day. Can you take 3 tablets today in the morning? It is not possible because more is the concentration of the drug more will be. Can you take lunch and dinner together in the morning so that it's going to last for the whole day? कधी कधी आपण डबल जेवण करतो पंक्तीमध्ये गेलो तर किंवा मोठं काहीतरी बिग फॅट वेडिंग आहे आणि 15 प्रकारचे स्टार्टर्स आहेत किती जेवतो आपण मोस्ट ऑफ द टाइम आपण जास्ती खातो पण तरी संध्याकाळी भूक लागते ना कारण का जेवणाची हाफ लाईफ किती आहे 12 hours. How much ever you eat in the morning you will be hungry in the evening. So we cannot manipulate this. परंतु मॅनिपुलेट करायचं असेल तर काय करावं लागेल बिकॉज इट वॉन्ट बी कम्फर्टेबल फॉर द पेशेंट टू टेक 6 times in a day. उसको रात को उठ के भी एक बार लेना पड़ेगा ना 12 बजे सोएगा तो 4 बजे उठ के लेना पड़ेगा 10 बजे सोएगा तो 2 बजे उठ के लेना पड़ेगा इट नॉट बी कम्फर्टेबल. देयर वी कैन मॅनिपुलेट दिस इज एन ऍप्लिकेशन ऑफ दिस. हे तुम्हाला कळलं की आपण घेऊ शकणार नाही राईट इथपर्यंत कळलं. Now, if you are not able to take this, we can make the drug in such a way, let's say in the tablet form. In the tablet form. Let's say, common example like diclofenac sodium, 50 milligram twice in a day is a regular dose. We cannot take 2 tablets at one time. But if you make a tablet like this, in which tablet is there in the two layers. Outer layer is 50, inner layer is huh. Outer layer is 50, inner layer is 50, and we make the inner layer more compact so that it doesn't get dissolved very easily. It gets dissolved only after 12 hours. Manjas Kyle, if the patient takes this tablet, when the same tablet will go to the intestine, only outer layer will be dissolved in first 12 hours. It goes to systemic circulation. It's going to act on the body and gets eliminated. But the tablet which is there in the intestine, inner layer, gets dissolved after 12 hours. Because elimination kadi honar, before absorption or after absorption? After absorption. This we have prevented the absorption. So he has to take the drug only once, but it acts for 24 hours. This mechanism is called as sustained release form. There is a drug called as Boveron SR, right? SR stands aminophylline, deriphyllin SR, Duvadilan SR. SR stands for sustained release form, in which the drug is kept in the two layers. You can also have three layers. Can it be more than that? Let's say, for example, somebody says that drug ka half life is 24 hours, and we make a drug in such a way that it is in the 7 layers. And every layer gets dissolved in 1 day. So you take the drug only once in a week. Is it possible? Think logically. Will it be possible? If yes, why are not drugs like this till now? If not, what is the reason for that? Logic. Will the drug remain for 7 days in the intestine? The food which you are having today will be excreted by what time? 36 to 48 hours maximum. So even if the drug, we can make the drug formulation like this, but is it going to remain for 7 days in the intestine? In the stool, will come out. So maximum we can manipulate for 1 day. कारण small intestine ती large intestine कडे जरी गेली गोळी तरी absorb होणार नाही. We cannot make it more than 24 hours because drug is not going to remain in the intestine for that much period. That much they are designing it. काय करतात? There is an anchor to the एवढं सगळं करायची काय गरज आहे फॉर एक्झाम्पल बट ते रिसर्चला काहीतरी पाहिजे राईट. So they give the drug in the multiple layer form and they give in such a way there's a huge tablet. It cannot pass from the pyloric sphincter. It remains in the stomach for 7 to 15 days. Because the tablet size is so big that pyloric sphincter doesn't allow for it to get past. It remains in the stomach. And हळूहळू करून dissolve होऊन मग 15व्या दिवशी dissolve होते मग ते pyloric sphincter. But it's going to act for 15 days. It's in the celastic form. So there is, of course, research is going on till now. Of course, we don't have tablet like this till now. But there is a research going on. This is a sustained release form. Can you also make the same forms in the other route of drug administration? Intramuscular forms. करू शकतो? आता हे सगळं कुठलं फॉर्म होतं? Sustained release oral form. Can you also make the intramuscular forms long acting? Depot preparations. Prolyton depot. Depot injection असतात ना? Every 3 months they give, right? Contraceptive injections every 3 months. It is an intramuscular injection. It's given for 3 months because the molecule is made more oily in nature. Remember, have you ever done prolyton depot as an injection? दिया है कभी इंजेक्शन? जब भी देते तभी ज्यादा ताकत लग Needle पण thick असते. साध्या needle ने तर drug जातच नाही. Also, we got to drip intramuscularly, and the syringe is also become so sticky sometimes because the molecular form is in such a way that remains in the muscle for 3 months.
So the study of proton has not been very successful
For contraception.
Yeah,
But see, effect wise it is okay, what we don't know. But I want the drug acts for 3 months, that is sure. Pharmacokinetic property, we can manipulate. Proton depot, the contraceptive benefit is good, but the only thing is menstrual disturbances are more. So continuing rate is very less compared to the OCPs because women want menses every month so that they are sure that they are not pregnant. And in proton depot, menses either doesn't come at all or they come anytime. So nothing can be planned. कि आज शनिवार रविवार था आज बाहर जाने का था और मेंसेस आ गए देवाला जायचं होतं आणि मेंसेस आले फॉर एक्झाम्पल so that is what all those things that is another story we are thinking about pharmacokinetic properties right now not for the effect so we can also manipulate this as a sustained release form so that we can reduce the duration of reduce the frequency the drug need to be administered so what decides the dose of the drug it is the bioavailability and volume of distribution. What decides the frequency of the drug? किती frequency द्यायला हवं? It's a half life that decides the frequency of the drug. इथपर्यंत लक्षात आलं? We also have the zero order. Let's discuss the zero order right now. Let's discuss the zero order right now. So if you apply the same drugs for the zero order मध्ये काय होत होतं? Amount of drug eliminated is constant. Now let's say it is 50 milligram eliminated per hour. So when you start from let's say 200 milligram, आपण कुठलं एक्झाम्पल घेतलं होतं? पहिले 100 घेतलं होतं ना? 100, 100 milligram. What will happen at the end of first hour? 50. What second hour? 50 milligram is eliminated per hour. It's constant, right? So first hour it will become, second hour completely gone. If you start from 200 milligram, first hour, eh? Because it is remaining constant. या ठिकाणी त्याला अर्ध व्हायला किती वेळ लागला? 1 तास. या ठिकाणी 100 व्हायला किती वेळ लागला? I'm talking about half life. If you think in half life, 100 चं 50 व्हायला किती वेळ लागला? 200 चं हाफ लाईफ किती व्हायला पाहिजे? 100 2 तास लागले. If you start from 300, फर्स्ट आवर मध्ये काय होईल? So higher is the concentration requires more time to eliminate. So do we have a constant half life here? Half life is not there in zero order because half life because the amount of drug elimination is constant. It is constant. Any example of the drug which is eliminated by this route? Any example? Alcohol. Alcohol is eliminated by this route by zero order kinetic. Zero order kinetic, but it is not that common. Alcohol is. Do we have alcohol as a drug? It is a drug. It is meant as a very good drug, as an appetizer, as a mood reliever, as an antidepressant, as an anti-anxiety, as an astringent, as an antiseptic. Also reduces cholesterol if it's taken in the right dose, of course, and also the right frequency because it's the only drug the dose decided by the patient himself. So that's another story. So that is what is in zero order kinetic. Zero order kinetic. if you're asked about, there are so many short notes in this, and this complete will be one LAQ called as pharmacokinetics. आता याच्यामध्ये एवढं सगळं लिहिता येईल आपल्याला? No, that is what is the writing practice, because knowledge is one thing, to be able to write is another thing. Short note मध्ये मध्ये आलं तर आपण लिहू शकतो. बऱ्याचदा काय होतं, too much, for example, see, writing an LAQ or an SAQ is an art. Just like, for example, do we have to by heart all those things? You will have to understand it. Steps कुठले कुठले, like a story. Whenever you see a movie and you are asked to describe the movie in 5 minutes, let's say you are traveling in the local train and your colleague is going to get down in the next station. Can you describe him a complete movie? हो, हिरो आला, हिरोईन आली, त्यांची भांडणं झाली, मग घरी पण भांडणं झाली, नंतर त्यांचं निस्तारलं आणि त्यांचं लग्न झालं, आला त्याच्या स्टेशन, उतरला तो, बरोबर. Now you're traveling from Churchgate to Virar. I don't have anything to talk, and the only talk is about that movie. Now you have got 1 hour to describe that movie. काय करणार? मग सुरुवातीपासून, मग म्युझिक आला, मग अगोदर जनगण मन म्हटलं आम्ही, आणि नंतर सुरू केलं, नंतर मग ते स्मोकिंगची ॲडव्हर्टाईज आली, नंतर त्यांनी सुरू केलं, मग तो हिरो असा होता, तसा होता, तसा होता, तसा होता, मग इंटरव्हल झाला, मग हे केलं, ते केलं, मग फायनली त्यांचं भांडण झालं. बाय द टाइम चर्चगेट स्टेशन विल कम. नाउ यू आर ट्रॅव्हलिंग फ्रॉम युअर मुंबई टू, लेट्स से, नाशिक, टेक्स अबाउट 4 hours. मूवीज किती मिनिटात होता? 3 तास. Can you describe the same movie in 4 hours? तेच सगळं सांगायचं, याने तसं केलं असतं तर तसा मूवी झाला असता, असं केलं तर तसा मूवी झाला असता, तसं. व्हॉट इज दिस? सो कन्सेप्ट इज द सेम. तुम्हाला जर समजलं असेल, यू कॅन डिस्क्राईब इट इन 5 minutes ऑल्सो, 1 hour ऑल्सो, 3 hours ऑल्सो, and 4 hours ऑल्सो. If you are asked about an LAQ, it is about 3 hours complete movie. If you are asked about an SAQ, it is 5 minutes. बट त्या 5 मिनिटामध्ये तुम्ही फक्त सुरुवातीचा पार्ट सांगितला, नंतर तर नाही सांगितलं, तर मूवी होईल का कम्प्लीट? सो व्हॉट आय मीन टू से, पॉइंट इज गोइंग टू रिमेन द सेम. Even if you are asked, let's say pharmacokinetic will be asked as a short note, will you write all those things? सगळं लिहिलं तरी ते मॅक्सिमम मार्क्स किती मिळतील? 5 पैकी 4, पण 5 पैकी 7 तो देणार नाही. सो सगळं डिस्क्राईब करायचं असेल तर pharmacokinetic is a body does to the drug. What body? There are steps like absorption, distribution, first pass metabolism, distribution, volume of distribution, redistribution and elimination. त्या सगळ्यांचे 2-2 पॉईंट लिहून मोकळं व्हायचं. आता हे सगळं बायहार्ट करायचं, याला थोडी स्किल लागते, आणि हाच त्यांना LAQ विचारलं तर हेच सगळं केलं तर डिस्क्राईब करायचं. आता ही रायटिंग प्रॅक्टिस पण तुमची व्हायला पाहिजे, कारण फक्त नॉलेज हे एक गोष्ट नाही आहे. Writing practice, in every month we usually give a paper for you to solve, and you bring those answer sheets. कारण those who are exam going, त्यांच्यासाठी 3 तास बसून लिहिणं is also a big thing. कारण you're not used to sit for 3 hours and write in the exams. कारण हे 2 वर्ष आम्ही जे घेतोय लेक्चर, त्याच्यामध्ये आम्हाला जास्ती भर रायटिंग वर पण द्यावा असं वाटतं. पहिलं थिंग इज अंडरस्टँड द कन्सेप्ट, second thing is understand the points, but third thing is able to write in the exam. What we have seen in those 2 batches is those who have got very good knowledge, they scored average marks. Those who have got an average knowledge but good writing skills, they were toppers. But knowledge wise, see, practice करायला काय लागतं? Knowledge लागतं. I'm not saying this marks are higher the marks you're going to practice better. काय नाही. Now that doesn't go hand in hand. If you know good about writing skills, with the less knowledge also you can pass the exam. मागच्या आय थिंक पेपर 1च्या रिव्हिजनला तुम्ही कोणी आला होता? पेपर 1 2 आठवड्यापूर्वी, तुम्ही पेपर 2 ला फक्त आला होता. पेपर 2 लाच फक्त आला होता. पेपर 1च्या रिव्हिजनला मी प्रॉपरली हे कव्हर केलं होतं की ऑफकोर्स पॉईंट्स कुठले लक्षात ठेवायचे, मध्ये मध्ये डायग्राम्स करा वगैरे वगैरे, पण जेव्हा तुम्ही लिहिणार तेव्हा तुम्हाला अनुभव येईल. अँड ऑल्सो इन दॅट टाइम लिमिट. 7 मार्काचा प्रश्न 20 ते 22 मिनिटात व्हायला पाहिजे लिहून सगळे पॉईंट्स मिळून. कारण बऱ्याचदा काय होतं की नॉलेज असून लिहिता येत नाही, कारण तुम्हाला खरंच एक्झाम देऊन बरेच वर्ष झाले. And that is what also need to be in these lectures we also cover that also. And आम्ही every month एक एक्झाम देऊन तुमच्याकडनं ते पेपर सोडून किंवा बाबा काय लिहायला हवं होतं, कसं लिहायला हवं होतं, and all those things. Because writing skills is also one thing, but we need to accomplish. आपण इथं स्टॉप होऊया, मी काय नवीन टॉपिक आता चालू करत नाही. अँड आय एम गोइंग टू मेक तुमचं ग्रुपमध्ये बाकीच्यांना पण इन्क्लूड करतो. बाकीच्यांना पण विचारा, अजून आपला ग्रुप अजून पूर्ण झाला, मिनिमम आपल्याला 15 जण लागतील, किंवा जे लोक न्यू बॉम्बेला येऊ शकतात त्यांनी तिकडे या. तिकडे ऑलरेडी बॅच सुरू झालेली आहे. इथे अडिक्वेट स्टुडंट्स व्हायला आपल्याला थांबावं लागेल, कारण एवढ्या स्टुडंटमध्ये आपण चालू करू शकणार नाही. आपल्याला अजून स्टुडंट माझ्याकडे आहेत एन्क्वायरीज काही काही, त्या एन्क्वायरीज आपण प्ले करूया. तर मागच्या वर्षी आम्ही जानेवारीमध्ये चालू केलं होतं, त्याच्या मागच्या वर्षी आम्ही एप्रिलमध्ये चालू केलं होतं. अजून एन्क्वायरीज आपल्याला बाकीच्यांना मी फोन करतो, तुमच्या कॉलेजमध्ये पण विचारा, कोणी इंटरेस्ट असेल तर आपण पुढे अजून थोडं थांबून हवं तर चालू करूया. वी डोंट हॅव एनी प्रॉब्लेम इन दॅट, कारण आपल्याकडे पूर्ण वर्ष आहे. इट्स नॉट अ टाइम बेस्ड प्रोग्राम, इट विल कंटिन्यू टिल युअर फायनल एक्झाम्स. कारण माझ्याकडे 15-20 एन्क्वायरीज आहेत, पण मी आज काय आले नाहीत की मुंबई मी त्यांच्याशी बोलतो, त्यानुसार पुढच्या गोष्टी आपण कम्युनिकेट करूया. तुम्ही लोक थोडं उशीर आलात. मी सुरुवातीला एक गोष्ट डिस्कस केली की आपल्याकडे दुसरं ऑप्शन असं पण आहे, एक